Hey everybody, Carl Rothschild here. The general topic is men's health, but the presentation explores the benefits of treating erectile dysfunction with Trifecta Light Therapy, a natural and safe treatment that can address the underlying causes of ED and deliver many benefits for overall health. Medical research has shown that about 30 million American men are affected by erectile dysfunction. From the research that I've done, I think it's even higher than that. So what are some of the common causes of ED? Well, many of them you already know. The main one probably is getting older. And even though I've read things where it says it shouldn't be that when you get older, you'll have a problem with this. But I'm telling you, eventually every man, and he gets old enough, if he can get old enough, he will probably be dealing with erectile dysfunction. Another one is diabetes, hypertension, obesity, hardening of the arteries, stress, anxiety, or depression. Alcohol is a big one. So is tobacco. In regards to alcohol, regards to tobacco, not only does it restrict the blood flow, but can lead to, of course, other serious diseases that may further impair sexual function. Prescription medicines, big deal. This is a big deal. Let's see, let me get the prescriptions. Okay, well, anyhow, so there's also fatigue and then brain or spinal cord injuries. Getting back to prescription medicines, I'm going to go into that a little bit more in a moment, but especially high blood pressure. The side effect, one of the main side effects of high blood pressure medicine is ED. And then, of course, there are many other conditions that can lead to erectile dysfunction. Whatever the cause, the end result involves a lack of blood flow into the penis, a lack of retention, and thus an inability to start and maintain an erection. So from a research point of view, each of you, if you want to learn more about this, or if people ask you about it, I always recommend scholar.google.com. This is where you're going to avoid the advertising, the baloney. You're going to get real nitty-gritty stuff. And you'll get a search engine that looks a lot like Google, but it's about research, it's about articles, it's about double-blind studies. And all you need to do is put in the word photobiomodulation, and anything after that, in this case, maybe you'll put erectile dysfunction or ED or a myriad of other things. Now, don't be surprised if there hasn't been a huge amount of research with photobiomodulation and erectile dysfunction in the United States. In other countries, yes. But in this country, it's about drugs, not avoiding drugs. But there's been enough research and certainly a lot of anecdotal evidence to show that it will be a big assistance to erectile dysfunction. And it, you know what, as I said before, it's largely about getting older. Erectile dysfunction or ED is typically associated with aging due to the blood circulation is diminished. While there are many possible underlying issues why men end up with erectile dysfunction, not having adequate blood flow is the main one. The natural production of testosterone does decrease as we get older. And then one of the side effects of blood pressure medicine, as I've mentioned already, is ED. And then I was talking about being overweight. Nearly 80% of men with ED are overweight. It's well known that being overweight leads to reduced testosterone and libido. And this is partially because fat cells begin to convert free testosterone to estrogen. Trifecta Light is an emerging non-invasive therapeutic method for treating erectile dysfunction. The foremost benefit of it is treating the root causes, not merely the symptoms. The net result of Trifecta Light is a cascade of beneficial chemical reactions, resulting in a major overall improvement in blood circulation. The key discovery is that it actually stimulates the tissues of the body at the cellular level. The light penetrates deep into the body through the skin and is absorbed by the mitochondria of the cells. That mitochondrial word is going to come up again and again, not only in this talk, but throughout any talks about light therapy. And you'll hear more about this over the years as people, there are doctors out there and professors out there who are convinced that it's the mitochondria that's, and problems with it, they call it mitochondrial dysfunction, are the root to many diseases. And we'll talk more about it in just a little while. The red light therapy actually energizes the mitochondria and accelerates healing and blood circulation, which increases cellular function. Red light therapy supports penis health and sexual health in 3 direct ways: increased production of energy in the cells, increased blood flow, and reduced inflammation. These benefits can be useful in treating the root cause of ED. Indirectly, though, red light therapy can treat hormonal imbalances that contribute to low testosterone levels, often called low T, which I'm going to go over in just a moment. The term red light therapy is used to refer to both red and near infrared. There's some misunderstanding, but it's really clear that red wavelengths range from about 620 to 750 nanometers, and near infrared wavelengths range from about 780 to 1200. I've studied all of these things. So remember, 620 to 750, that means you're going to see it. It's not invisible to the naked eye. Near infrared is invisible to the naked eye, and those are the lights that are from 780 to 1200. With the red light, it's mostly the mid 600 range that we use, have phenomenal results with that. And in the near infrared, it's mainly the mid 800 nanometers. Hundreds of studies have shown that the greatest amount of positive biological effects on the human body are achieved within what's known as the therapeutic window, which I just mentioned, between 630 and 660 for red, and between 810 and 880 for the near infrared. So I just wanted to play this video for you. It really summarizes how photobiomodulation works, and we worked hard on this one. So take a listen.
Every living organism requires energy to survive. In the human body, that energy is called ATP, and it is made in little energy factories inside our cells called mitochondria. The more mitochondrial activity, the more ATP is produced. That makes us feel better and heal better. There are 2 known ways to increase mitochondrial activity in the body. One is intense physical activity, like exercise, and the second is sunlight. Sunlight is made up of a spectrum of wavelengths, but it has been discovered that it is the red and near infrared wavelengths of sunlight that are the most healing. They easily and painlessly penetrate all layers of the skin. The red light makes it to the fat cells and opens up transient pores, allowing the fat cell contents to be released, while the near infrared light will reach right down into the mitochondria to produce more ATP and accelerate healing. Scientists have discovered a way to amplify and focus red and near infrared light rays for maximum fat loss and increased energy production without having to perform hours of strenuous exercise. It is called Trifecta light. With the Trifecta light, clients experience dramatic facial rejuvenation, fat reduction, and increased ATP production with every session. And this helps them look better, feel better, and with the increased energy, experience more out of life.
I hope that gives you a good summary of what this is about, but I have another little slide here that I put together. So imagine you've got the Trifecta light therapy going through the tissues, that's red and near infrared. So it delivers that red light and near infrared straight to the body and its cells. The light is absorbed by the mitochondria, which greatly stimulates cellular activity, and this results in increased production of ATP, RO, which is reactive oxygen, and NO, which is nitric oxide. The ATP increases the cell's ability to recover, produce energy, and accelerates the healing process. The RO, or the reactive oxygen, is all about cellular repair and healing. And the nitric oxide increases circulation, decreases inflammation, and enhances the transport of oxygen and immune cells throughout the tissue. So it's just another way of looking at what this can do. But remember, the core verbiage is ATP, nitric oxide, and mainly the mitochondria. The ATP is a high energy molecule whose sole function is to store energy in our cells. Our body uses it to do pretty much everything. Some cells, like muscle cells, require a lot more ATP than others because of the intense demands placed on them. Now, when I went to school back in many years ago, it was thought there was just one mitochondria, and that was it. Well, I'm going to tell you in a little while more about how many can be found in certain parts of the body. in an effort in a constant effort to achieve homeostasis or balance, humans recycle their own body weight equivalent in ATP every single day. I had no idea. I've been doing research on this, and I didn't realize the amount that was generated. So you can see how important the ATP is. It not only is our energy source, but it keeps the body going. The more efficiently cells can make and use energy, the better the body's function, obviously. So a little bit more about photobiomodulation. This is kind of a summarizing. I know I'm repeating some of the things. I want to drive it into you. Photobiomodulation stimulates the mitochondria of the cells. We know that dramatically increases ATP production and increases blood circulation. It increases nitric oxide. We talked about that, but it also creates new blood vessels. So it will help your body create new blood vessels when necessary. Also, I'm going to talk a little bit more in detail about how the lights can actually penetrate the skull into the brain in a great way. And it's proven to improve sexual function. And then a little bit more about the sperm and fertility. Photobiomodulation leads to a significant increase in sperm count, as well as an improvement of the quality and motility or movement of the sperm themselves. And then testosterone, which again, I know we're repeating this, but it significantly, the PBM significantly boosts testosterone levels in men. So I just want to go over the mitochondria even a little bit more detail. Again, forgive me if there's some repetition here, but again, the two key words I think you're going to hear a lot more of in the future is mitochondrial activity and mitochondrial dysfunction. And if you looked either of those up, especially the dysfunction, that's a new term, relatively newer term. And you're going to see doctors who are feeling confident that that's a core reason for a lot of conditions out there. So these are tiny organelles inside cells that are involved in releasing energy from food. It's microscopic. You can't see it. That's why they thought there was only one when they, over the years, once they got electron microscopy and the ability to see better, the process is known as cellular respiration. That's what we're looking at here. It's the reason that the mitochondria are often referred to as the powerhouses of the cell, because what they do, they're in every cell in the body. And the cells that require a lot of energy, such as the muscle cells, contain hundreds or thousands of mitochondria. So guess which organ or gland or body part in your body has the most mitochondria? It's the heart. The heart has over 5,000 mitochondria. Photobiomodulation stimulates the mitochondria, the cells, which dramatically increases ATP production and improves blood circulation. You haven't heard that from me before. So I just want to play a quick video on mitochondrial activity. I thought this was pretty good.
Our bodies run on energy. Even as you sit watching this, your body is generating enough energy to power 7 10-watt light bulbs. Most of that energy is provided by tiny structures called mitochondria present inside our cells. These mitochondria are the powerhouses of the human body. They take fat, sugar, and protein from our food and combine it with oxygen, converting it into energy for our cells and tissues, such as brain and muscle.
I want you to remember, I'll stop this for a second. I want you to remember that it's all about the sun. And maybe I should probably mention that earlier on. It really is just about the sun. What we've done is we've taken several elements of sunlight, eliminated the ones that we don't want to bring into the body, like UV light and a couple of others. And these three main ones, which is 2 elements of red and an element of near infrared, we concentrate it many times, magnify it many times, and drive it into the person's body.
Our body.
So now about nitric oxide. The leading cause of erectile dysfunction is poor blood flow, as you've heard. And nitric oxide dilates blood vessels, which in turn can increase blood flow to the penis. The key to getting and maintaining erections revolves around continuous activation of nitric oxide. And red light therapy greatly increases the release of nitric oxide in the body. I'm going to go over these slides real quick. So nitric oxide and in your 20s, the vessel, and that's what this image is here, is the vessel looks great. As we get older and we have lower amount of nitric oxide in the body, we're going to see a thickening of the arteries to the point where at 15% nitric oxide. Now, this doesn't guarantee that everyone in their 60s is going to have that, not at all, but this is the average. If you're staying healthy, doing all the things you need and add red light therapy to it, you're going to experience a tremendous reversal of such a thing, where we'll have 60-year-olds having vessels that are much younger. But at the 15%, we're talking about likelihood of heart attack. And this is something that we'd like to avoid. And that red light therapy can assist that. Now, when testosterone, red light therapy has been shown to enhance testosterone secretion by way of increasing ATP production in the Leydig cells of the testes. So if we can, and that's why we have the patients get in the bed naked. And so we're going to be going from a low amount of testosterone. And again, if you go to look up photobiomodulation space testosterone in the Google Scholar website, you'll see some information, as I had mentioned, about testosterone and about all the other things that I'm talking about. So we're talking about the brain. Exposure of photobiomodulation on the scalp has been shown to affect cortical areas of the brain, which has proven to significantly improve sexual function. So if we were to look at the brain, the two main things we want to look at is the hypothalamus and the pituitary. And yes, the light penetrates and affects the hypothalamus and the pituitary. Again, remember, the light is not about excessive amount of energy or taking, so we're not taking anything out, we're not putting anything that shouldn't be in, and the term I use is bringing the body or that body part back to normal. So what happens is the hypothalamus stimulates the pituitary, stimulates the testicles to produce testosterone. And all of this is enhanced with red light therapy. So in summary, the more efficiently your cells create ATP energy through cellular respiration, the better your body can feel and perform. The red and near infrared from Trifecta Light Bed supports mitochondrial function and the efficient production of ATP energy through cellular respiration. Red light therapy treatments should be a part of healthy, balanced lifestyle and could help support enhanced cellular function. Combined with exercise, nutritious eating, and restful sleep, healthy light intake can have a big impact on maintaining and improving anyone's health. So this is our Trifecta Light Bed. The person gets in it, 12 to 15 minutes, and the results are absolutely spectacular. So I want to thank you for listening. I kept it as short as I could and reviewed a lot of stuff. I know there was some repetition, but I really appreciate you listening to this. So if you hold on one second, guys.